It's that time. We're going to talk about mumps. So I sent out a lot of social media announcements to make this known that we're going to be talking about this topic at this time on the live YouTube channel. And I expect to see some people. I think Lindsay Vaughan was planning on making it. And you guys are certainly welcome to go ahead and start commenting now. We'll get into the topic after a little bit, after we get a few people here. We've got about 12 here with just right off the bat starting, 26. So the topic is the recent mumps cases that we've had here in our area. A couple of high school just up the road, just a few miles, had it. Hey, Candy Laver 101, glad to have you here. Those of you who are watching this after the recording, you'll notice that I shout out people's names as they comment. You won't see the comments. It's the people who are part of the live presentation who get to be a part of that. And so I'll interact with the live audience, people interested in the topic after the fact. We'll see this. This may even end up being our posted video for Friday for this week, because I expect it to be a very good discussion. Yes, Norma Jean Green, I do see you. Hello. Thank you for being a part of this. And thank you for the thumbs up. Thank you for the comments. If the comments get just a little too wild, it's hard for me to keep up, then I'll switch it to the paid comments only. That option's available if it gets that popular, and that'll help to let everybody get what they want, hopefully. Okay, we'll go ahead and answer the question, how is mumps transmitted, since that's already a question before we really get into the background, but that's fine. We'll go ahead and jump into answering questions. Mumps is transmitted just from being near people. It's a virus, and it takes about 14 to 18 days after you're exposed to it for you to get mumps and come down with it. So close contact. That's why when people do get mumps, we keep them in isolation. We do not want them to be around other people. Yes, hi Regina, I do see you there. And hello, Kristen, we do see you also. There's actually recommendations for healthcare workers who don't have evidence of immunity. It's expected that they will be anywhere from, I believe it's in the range of 10 to 25 days, a little bit shorter than that, but that's how I remember it, that they should not be at work being around patients when they have been exposed in the clinic to a patient who has mumps. And that's a long time. So evidence of immunity. How do you have evidence of immunity? Well, if you're born before they had the vaccine, chances are you were exposed to it because it was so common. It was everywhere. Everybody was having it. And then if you're born after the late 60s, then they give you, they can actually test for the blood test to see if you have immunity to it. Okay, Regina asked, do you get really puffy cheeks? Yes, that's one thing. It can be puffy cheeks, what we call parotitis. Not an inflammation of your parrot bird, but the parotid glands, titis or parotitis, and it can be one or both, and it, in some cases, doesn't even cause the swelling of the parotid glands. It can affect other glands in the body. For example, one of the very known problems with it is infecting the gonads, testicles in men, ovaries in women, although not so often in the ovaries, but more so the testicles. 30% of sexually mature men who get mumps will get the orchitis or inflammation or infection of the testes. And in fact, about 15% of sexually mature males who get mumps will have some degree of sterility or impaired virility because of it. It's actually rare for it to be 100% sterile because of the mumps, but it is a risk factor. So let's go back here and see what you guys were asking while I was talking. Norma Jean asked, so if you had your shots when you're a baby for mumps, can you still get it? You shouldn't be able to. It's 97% effective if you get both shots, and it's somewhere around 75% effective if you got just one of the shots. And Lena's saying check your titers. Yes, you can have a blood test done to check your titers just to make sure. People refuse vaccines for the kids. Yes, it is sad that happens. They do it for various reasons, some of them a little more reasonable than others. The reasons I consider not to be reasonable is you heard something on the internet or from a friend that said it was bad for such and such reason without checking for yourself to see what the evidence is. I think that's a bad reason to not get it. Not all the kids have it. Yes, without having all the kids vaccinated against it, now we're seeing mumps, something that hasn't been seen for decades around here. And it's because not everybody is getting vaccinated as used to be the practice when when the vaccine first came out, they would line the kids up and everybody would get it, and parents were happy for their kids to get it because they knew people who had been hurt by it. Now, thankfully, mumps doesn't hurt a whole lot other than that 15% of impaired ability to have children in men, and that is a big deal. It impairs it. Very rarely does it actually make them truly sterile, though. Also, a certain percentage can get meningoencephalitis, and that can have permanent effects, messing up their brain. Do the side effects of the vaccines outweigh the benefits of immunizing against the mumps? Side effects, I'm sorry, let me read that again. Do the side effects of the vaccines, there's hardly any side effect whatsoever to the mumps vaccine. Redness, soreness, having to get a shot, outweigh the benefits of immunizing. The benefit being that your child doesn't have risk of having impaired ability to have children if they're male, risk of meningoencephalitis, very small incidence of very serious reactions. There can be deaths from it, although usually not. But it is a good thing to avoid since we don't know of any real serious drawbacks to the mumps. Of course, any vaccine, you can have an anaphylactic reaction. It can result in death. The risk is very, very small. The risk of your child getting the disease and having the same thing happen from the disease is greater than from having happened from the vaccine. Very small risk. To the point that looking at the numbers for the general population, I would say everybody get it. Now, you can have other situations where an individual has special circumstances where you consider not getting it if you know that they have a reaction to something that the vaccine is made out of. Well, then that's reason to proceed with caution. We would like to keep that number of patients in that pool limited to people who need to be in that pool. Kristen King, how do they combine the vaccines in the lab? I know it's given with measles, mumps, rubella together. Yeah, they put them. I don't know the mechanism. I'll be honest and say I just know that the three of them are put together in the bottle, and you get all three when you give them. And then Regina's even pointing out that there is a quadrivalent vaccine, the MMRV, that also includes varicella or the chickenpox vaccine. Now, chickenpox vaccine also is one that you give twice. MMR is one you give twice, so it makes sense to have those together. Vaccines is not linked to autism, can it? Not sure about your syntax, but I think I know what you're trying to ask about, and that is the concern about a link between specifically the measles vaccine and autism. There's been a lot of stuff in the media and on pop culture, books written, and I will even, I hesitate to do this, but I'll go ahead and do it. You guys know that I'm a fan of Dr. Paul Thomas. He has written a book on vaccines. I have not written it yet. Dr. Thomas, if you send a copy to me, I'll read it. The vaccine-friendly plan, I believe is what he calls it, or the family-friendly vaccine plan, something like that. And of course, if you look at Dr. Paul Thomas's videos, you'll see links to it. I believe it's at Dr. Paul Approved. And I have watched a number of his videos, so I know that he has some concerns about specifically the measles vaccine and autism from what he has personally observed in his practice. And again, this information I'm giving you can find yourself just by looking at his channel. It's from watching videos where he speaks about that concern. He recommends that people with family members who have already developed autism, and it was after getting the measles vaccine, that they not do that to their other family members. I disagree with him in that the evidence that is being gone over by the CDC and the NIH and other bodies like that and infectious disease specialists doesn't agree with what he says he's seen in his personal practice, and I don't know that he necessarily has run any statistical analysis on it. He may have, and I don't want to accuse him of something he has or hasn't done, because I respect him the utmost, and I know he has his reason for doing it. I disagree, and it looks like most of the medical community also disagrees. It's looked at studies on this. Let me look and see what some of your questions or comments have been here. Oh, Omar's here. I wanted to tell you guys, Omar has a channel. He'll probably tell us what the link is if I ask about it, where he talks about health topics also on YouTube. So recommend checking out Omar. He really liked that wound from the Mohs surgery. Oh, he's talking about a recent video that we did. It's pretty cool. We actually went to another doctor's office, Dr. Trauner at Roseville, or Sacramento ENT, their office in Roseville, not in Sacramento. And we did a video on Mohs surgery, 3-part series actually, 3 videos. Adele's asking, all 3 of my kids were vaccinated and my son is autistic. Yes. And people who weren't vaccinated also, you have autism also. Which points out where did this even suspicion of a link come from? Well, it came from a rise in the identification of autism occurring around the same time that the vaccine started being given. It occurs at around the same age or a little bit after where those vaccines are given. And so the thought was maybe there's a connection. Looks like under statistical analysis and studies that turns out, no, it's just the age when that happens. It's not necessarily a causative effect. Thanks for the show. Oh, yes, Omar. Omar, you got to give them your name of your channel if you want to get people to come to it. So make sure you give us that, and I'll try to make sure I see it. And Regina's saying, I thought autism was something developed in utero. No, you don't even know a child's autistic until they're starting to have some missed developmental milestones. And you don't have that in utero, so you don't know until a certain age whether it's there or not. Some people do think it's there. Other people are pointing out, no, they made these milestones and then they regressed. That's especially the concern for the people that talk about the vaccine being causative is when they've seen. And for those of you who are very, very much on the vaccine bandwagon, listen to this carefully. There are parents that saw their children make certain developmental milestones, got the MMR vaccine, and then they witnessed regression of those milestones. And that is very convincing to that segment that that's what caused it. Hey, they got up to this point and then they declined. And so that's, you need to have a lot of grace when in communicating with people who have experienced something like that, because it's a very reasonable thing for them to do. And then the whole emotional side of it, when it's your child, it's hard to be able to speak to that with just facts and statistics because they have an experience, and a person with statistics and facts will always lose in trying to convince the mind of people when there's somebody with a personal experience. Not to say that that's necessarily correct, it's just we have to take that into account. Okay, so we have some comments here. Oh, by the way, if you do want to guarantee that we look at your comment, use the super chat function. That's the little $ over the side when you chat. Okay, let's back up a little bit. Jenny Mueller was asking what are the early symptoms of mumps. It's like any other viral illness. You feel sick, fever, tired, don't feel like going to school. Mumps specifically oftentimes will be associated with swelling of the parotid glands, the salivary glands over on the side of the face here. They look like a chipmunk. And it can be one or both. Quite often it's both. It can also affect some other glands. I hadn't said it earlier, but I was talking about other glands that can affect, for example, the testes and the ovaries. It can even affect the brain with meningoencephalitis. But it can also cause pancreatitis, inflammation of the pancreas. That can be quite a problem and be associated with abdominal pain. Regina says, so the kids in my office as so precious until they scream. Okay, it looks like I jumped into the middle of a conversation there. I do want to give you guys Omar's YouTube channel. It's Live Healthy, and it's the one with the heart using a barbell. There's a number of things that come up if you search for Live Healthy on YouTube, and his is the channel with the heart with the barbell. It looks like it's getting fit. Once again, appreciate the chat. Absolutely, Omar. We appreciate you being an active part of this community and interacting. So, Billy Goat 126, which I love your avatar, by the way. It says, didn't Dr. Paul Thomas from here on YouTube write a book on vaccines? Yes, the vaccine-friendly plan or the family-friendly vaccine plan, something like that, and you can find it on his website, which is drpaulapproved.com, I believe. Scott, thanks for the compliment there. higher because medical science has gotten better over the years, so it's easier to diagnose. That's one possibility, yeah. Is it being diagnosed more often because it's recognized more often, not because it's more prevalent? That is one possible explanation, and I'm sure somebody who has studied this even more than myself would be able to say, sorry I'm moving you guys around so much, I'm trying to get it a little more even, would be able to say if that indeed is the cause for these numbers. It may also be something environmental, vaccine or otherwise, that is causing an increase in the numbers, that it's not just that we're recognizing it more often. From Kansas, we have an outbreak of mumps. You guys have it in Kansas too? We had it in two kids in a high school just up Highway 49 from us. Just here last, I think it was around February 23rd or so, that they put out the official announcement of this going on. We even had a patient in our office that had unilateral parotid swelling. It was an older gentleman, and we're testing him through the county to see if he actually has mumps. If it turned out to be positive, this would be a big deal. Okay, going back to the comments. And are the disease coming back because parents are not vaccinating? Yes. There's the concept, we should touch on the concept of herd immunity. The idea of herd immunity is everybody will be safe. Even the ones who don't get the vaccine to take, like I said, it's only 97% effective after 2 shots. But even that 3% that's not protected by the vaccine will be protected by herd immunity if enough of the herd, meaning everybody, is vaccinated. Now, at what point do you lose that herd immunity benefit? Unfortunately, we don't know for any particular disease until we've reached it. And that has happened with measles, and it looks like now it's happened with mumps. So we're a little disappointed in that. California, they had their own little way of addressing it by putting into law that you can't get out of the vaccines anymore because of a personal or religious reservation for getting the vaccine. I have concerns about that law because I feel like that's a bit Orwellian to make everybody have to get these vaccines and for it to not be a voluntary thing. But it also bugs me that people are not volunteering to do it across the board. That's a concern. I don't know what the answer is. My preference is that everybody participate. My preference is that they do it willingly and that we don't make people do these things. I've even had a very hurtful personal experience related to this. Somebody that I grew up with contacted me through Facebook. Their child was not a patient of mine, and they asked me to sign off for their child not to get the vaccine after this law went through. Well, I don't have any legitimate medical reason to do that. I know they have their own personal story, but it's not something I normally would have done. Plus, they weren't my patients. This was just a friend asked me to as a friend, and I said, you can't use my medical license that way. That's it's for another purpose. It's for doctor-patient relationships and working within that sacred environment. And they got very upset and posted not nice things, and it was unfortunate. And that was, because of me going along with good medical practice, not just doing whatever somebody asked for, even though it was a friend. And of course, I forgive them, and I hope to have reconciliation sometime in the future, if they come around. BooBoo Kitty, yes, thank you for telling people where I am. BooBoo, thank you. Oh, by the way, everybody, BooBoo Kitty, one of our patrons on Patreon. You can find her Patreon at patreon.com/Auburn Medical Group. She will be a part of the patron-only Google Hangout at, I believe it's at 7 o'clock Pacific tonight with me, which is only for those who are at her level or higher. So yes, BooBoo, we have a date at 7 o'clock Pacific time, 10 o'clock your time, which thank you for letting me do it that late, by the way. Okay, back to your comments and questions. BooBoo Kitty says New York's like that. They can't start school without it. The homeschooled kids are exempt. And then actually in California, I think they dropped the homeschool exception. That's why the law was a little more strict here. And Lena, you did the right thing. Thank you, Lena. Appreciate that. It's nice to have people with shared beliefs. But It's also good for us to be exposed to people who have different beliefs and different perspectives. It helps us to sharpen ourselves by being able to interact with them. Jenny, do other countries vaccinate like the U.S. does? Actually, it's U.S. is kind of funny in the world as far as vaccines. The U.S. is unique in that there's people not getting vaccines. The rest of the world is still very close to that age of these horrible viral illnesses killing their children. And although mumps didn't kill that many, so I shouldn't sell it too hard. But polio, for example. People who grew up with polio just can't believe people not getting the polio vaccine because they remember iron lungs. They remember kids with the disabilities, with the shriveled legs that were all around them, and the horrible toll that it took on humanity. Thankfully, polio is almost eradicated. There's only 1 or 2 countries left. Rotary International actually has it as their mission to eliminate polio from the world. So if you didn't know that about Rotary, that is a wonderful thing about them. They deserve a lot of credit for their work there. Adele, you say that you found my channel about a month ago. It's awesome to get this information. I'm glad you appreciate it, Adele. Hey, by the way, you guys, I noticed we got up to like 50 people on, and now it's down around 21 or so. I'm willing to go ahead and go on, continue to have this discussion if you guys want to. So go ahead and share it with people who you think might want to participate. That'd be great. We'll still be here for a while because we're having a very good discussion going on here. We have Rose who says, I've had the shots when I was younger, and now I'm 50. I'm covered. Yes, you are covered. Yes, we do consider it to be lifetime immunity if you got the 2 shots, or if you were born before the late 60s. If you want to get checked, you can, but it's about 97% effective for mumps with the shot. Specifically talking about mumps because that's what's going on around here right now. Jenny asked, can you provide information about treatment if someone gets mumps? I would direct you to the CDC, cdc.gov, and then go ahead and search through there for mumps. As far as treatment, it's just supportive. If they have a fever, give them acetaminophen, the generic for Tylenol. And if they were to get, and isolation is the other very important part of treatment to keep it from spreading to others who aren't benefiting from either their own vaccination or their own immunity from having it, or herd immunity. Actually, no, herd immunity doesn't help them if they get exposed to it, excuse me. Treatment for the more serious things, if they were to get meningoencephalitis, they might be given steroids in the hospital, or they might be even have to go to the ICU. And let's get back to, Billy Goat 126, interested to know how your grades were in high school because you obviously turned out great. Well, thank you for saying that. High school grades were very good, a 3.86 GPA before the age of AP test. I shouldn't say before. There were people who had AP when I was in high school, but that was without any AP. But thank you for asking. That was kind of nice. And Mr. and Mrs. Forever says, thank you for answering questions. I wish doctors educate like you are. I'm enjoying your channel. Thank you. Appreciate that. Yeah, I enjoy it. That's why I'm doing it. Maybe not all doctors would enjoy doing something like this. Maybe a lot of them would, but they just aren't with it enough with technology, which actually brings me to another topic. Maybe we'll do it on another show, of this letter from a doctor in our community sent to his patients when he closed. That's something to look forward to. I'll have to figure out a way to promote that because it'll be an interesting discussion. And it'll touch on current healthcare reform, what the Republicans are doing currently, and the Affordable Care Act and its destiny. We'll see here. Moving on, Kristen loves what he does. Yes, I do. And yes, thank you, Billy Goat. And Omar, the Vaughan doctors, Dr. Allard, Dr. Melick, Dr. Gilmore, favorite physicians on YouTube. It's funny that you say that group, and that's the group that we did the roundtable with on YouTube. But I also would throw, well, of course, Dr. Pimple Popper goes without saying. Everybody loves her channel and what she does. But Dr. Paul Thomas, I am a huge fan of him and encourage anybody who enjoys medical discussions on YouTube to look at his channel. And then I've also, I haven't really said much about this yet, but I've also discovered that the John and Hank Green brothers, Vlog Brothers, in addition to their SciShow and their, I forgot what the one with the history and the psychology stuff, Crash Course, that's what it's called. In addition to those channels, they also have Healthcare Triage, which is neither of the Green brothers. It's actually a pediatrician, academic pediatrician in Indianapolis who does that channel and does a tremendous job, way better than I ever could, talking about healthcare policy type issues. And he talks about other healthcare topics too. He was just at NerdCon somewhere on the East Coast last week or the week before. They had a lot of live roundtables with him, just answering questions from the audience about healthcare policy mostly, but other health-related topics. Okay, we had a comment there from Kristen. Those are my go-to doctors as well. Yes, they're cool. I do enjoy watching them. Love to see you discuss how you became a physician. Okay, does anybody know if I have a video on that already? I'm trying to think. Definitely you can find it on our old podcasts. The Auburn Medical Group podcast. Auburn Medical Group. Also, for a while, there was Ask the Doctors podcast that definitely has that for both myself and Dr. Gwaine. Yes, BooBoo Kitty, have you come across our podcasts or listened to any of them? Auburn Medical Group. We're not currently making them. Stopped a little bit over a year ago, but we used to have a weekly podcast. And I've also done some monthly podcasts, but that's not related to what we're talking about today. Looking back to some comments here. Mumps in pregnancy. Okay, mumps in pregnancy, if it's during the first trimester, it causes a lot of fetal loss. Enough that it's a very big deal to keep pregnant women away, especially if they're not vaccinated, don't have evidence of immunity, keep them away from people who have mumps or anywhere near mumps whatsoever. Now, trimesters 2 and 3, they seem to have protection from the mother, and for the first year of life, babies seem to have adequate protection from the mother's immunity against mumps, and that's why they start the immunization cycle after they're a year old for mumps. Oh, BooBoo Kitty's letting out somebody's name that nobody knows that name that you use there, BooBoo. That's a secret name. I won't give any details so that nobody will figure it out, but she knows who I'm talking about. And even on the video that we just put out today on the, okay, a lot of you guys might know I have another channel besides Auburn Medical Group on YouTube called Dr. Terry Bull. And on Dr. Terry Bull, the one that just came out today, which is about not the dew point, but the poo point, thanks to a question from BooBoo Kitty, actually. We did a behind-the-scenes video for that, which probably will come out next week. And even on that, we don't let you know that secret name. In fact, we don't even show him without his costume. Daryl and Daryl, that's right. Yes, Jenny, the word is poo. It actually is poo point. The video is now live on the Dr. Terry Bull channel. Don't watch it until we're done here. But after we're done here, go straight to the Dr. Terry Bull channel and look for Poo Point that just came out at 4 o'clock. Okay, Rose asks, if I had the shots 50 years ago, am I safe from getting the mumps? The answer is 97% yes. And Pamela, yes, hello. And Jenny, all right. So let me move down to the most recent comments, which are from Kristen, who says, hello from Oklahoma, just joined. Thank you, Kristen. We're glad to have you here. We're having kind of wrapping up a discussion on mumps, actually, because we've had outbreaks across the country, and one of them was here, where we had 2 kids in a local high school last month come down with mumps, and we're very much looking out for it and talking about how to vaccinate against it. You'll be able to watch this video. This video will be available on the Auburn Medical Group channel. We'll go ahead and make it live to everybody. A lot of these videos that we do live like this will end up only available to people on the Auburn Medical Group Patreon. So certain patrons will be able to access that at a certain level where you can get the videos. But this one, we'll go ahead and make this one available to everybody. It's been a very good one. Had a lot of interaction. Okay, Jenny, does breastfeeding help a baby to have longer immunity from the mother? The answer is yes. It actually does help with immunity and antibodies. Kristen, we have had a mumps outbreak in Tulsa, even in Tulsa. So yet another location. Billy Goat. Oh, are you a medical student? Billy Goat 126 with the awesome avatar is a medical student? My advice is make sure you love it. When you apply to residencies and you go and interview at them, they'll tell you all sorts of stuff. They'll give numbers that, some of them pay better than others. Some of them have a little bit more vacation. Some of them have different call schedules, less or more. This is what you look for. I'm looking right at you, man. This is what you look for when you go to a residency interview. Are those residents happy? There you go. So I don't know what year you are, but when you're going around in fourth year and you're interviewing, that's what you're looking for. Okay, Kristen. Oh yeah, we have a couple Kristens. And Lady Weasel is nursing. Great. Good. And even Toronto, Ontario, yeah, boy, just mumps is around. All right. Daughter had febrile seizures, didn't get her last set of MMR vaccines 30 years ago. Does she need to get a booster? Okay. I wish I know. We can get an exact answer on the CDC website. So go to cdc.gov. But what I'll tell you is for mumps, it's 97%. For the measles and rubella, it's going to be close to that. I'm sorry, 97% if you get both, 75% if you get just one for mumps. So it's a great degree of protection, even if you get just one. You can still get titers drawn with your doctor if you want to know for sure if you have protection. But it's easier just to get a second shot if you're really concerned, because there's no downside to it, and they'll go ahead and give it to you. And it should be covered by most insurances. Somebody with myasthenia gravis should be concerned about mumps. For those of you who don't know, myasthenia gravis is a problem with neuromuscular receptors where nerves attach to muscles to make them work. And in this case, these people have a problem at that point, and so they have muscle weakness. I believe it would aggravate your weakness if you were to come down with any viral illness like mumps. Do vaccines wear off? I can't pay for Super Chat right now. It's okay, Regina. I'm reading it. There's not too many people. What can happen is people can have problems with their immune system where they don't have the benefit of it, like people with HIV, for example, or people with blood disorders where they have problems with their immune system. They will have wear off. But for a normal person with a normal immune system, it's just the normal age reduction in ability to fight illness, but the vaccine is still just as effective for your level of immunity. All right, there's another question that came up here. Yes, Drew in finance, you're welcome. Is there a test for a wide range of titers with one blood draw? Not that you would normally get from your regular doctor's office. There is one for the measles. That's the one we most often are checking. Yes, Kristen, you're welcome. And yes, I hate needles too. You have to get varicella again. Regina, you must be young. Those of us who are of a certain age, we were around varicella. In fact, we consider adults, age 50 and older, even if they don't recall getting a case of chickenpox, we consider them to be immune just by being in the community because it was so prevalent. So you may not have had a clinically apparent case, but you were around it so much that you most likely, when we test, we find out people who don't remember having a clinically apparent case of chickenpox do have the immunity against it just because it was so prevalent. You'd have to be an absolute hermit way up in rural Alaska to not have gotten it when you were growing up. Somebody had mumps when they're little, don't need a shot as an adult. Yeah, we already went over that question. And have to get varicella for work because you're 30. That's okay. We'll call that young in this case. Yes, you are welcome, Rose. We are glad to answer your question. So this has been a great session. I appreciate you guys being a part of it. I would be curious to know if you guys could just tell me, did a lot of you see the announcement before this, either on Facebook or Twitter, and come because of that? Please let me know if any of you have done that. I'd really like to know if that's an effective way to get this information out of upcoming live events that we do. Looks like Regina did, but a couple people didn't. Oh, Christina Hartman. Okay, so you saw some kind of social media announcement about it. Good. Regina, YouTube told you once it was live, because I don't know how to make YouTube tell people ahead of time, because I do it on a mobile device. BooBoo Kitty saw the announcement. Jenny got notification when it popped up live. Kristen said, saw the announcement on YouTube. Naomi, YouTube. And Lady Weasel stumbled upon it on YouTube. Cheryl McNutt on YouTube. Adele, YouTube sent you a notice because you're a subscriber. Marion Francisco, yes, hi. Kristen, when you went live, and Lena YouTube. Okay, so it looks like a few people did, so there's benefit to doing it if I can plan it out. Is this a good time? I guess obviously it's a good time for you, unless this is an exception. If anybody says this is a horrible time, I just happen to be able to just this once, because you're homesick from work or something, or got home early, let me know if this is a horrible time for you, but it seems to be working. The only reason this would not be an ideal time for me is because it's when I'm usually running and getting my exercise to stay fit. So we'll try to come up with good times. It's very hard to find a good consistent time so that I can be here and you guys can know that these are coming on live to be able to enjoy them. But we're working on it, so we'll keep working on it. This is a great time for Adele. Regina wants to talk about arthritis, possibly. Kristen, perfect time. Really appreciate Dr. Okay, so as far as upcoming, because Regina was asking about upcoming topics, I do want to touch on doctors being able to adapt to, say, the Affordable Care Act or whatever else is coming from federal legislation, and computers in medicine because of, I'll just, kind of tease it here. This letter from a doctor. I took out the patient's name and address so you guys can see the letter. I'm not going to tell you the name of the doctor. You couldn't tell who that was unless you absolutely knew it. That signature. All right, let me look and see what your most recent comments were there. Yes, Billy Goat, you too. Exercising now. Good for you, boo-boo, because we have a date on the patrons on Patreon, Google Hangout, in just probably an hour and a half, I think. So, hey, guys, thank you so much for being a part of this. This will be live for everyone, 4 o'clock tomorrow on the regular channel. It's not going to just be for patrons. This will be for everybody. And this is in place of a procedure video for this month. I want to let everybody out there on YouTube know that this is another part of what we do at the Auburn Medical Group. A little bit different from our usual procedure videos, but I hope that it's valuable for people. We'll check, see the numbers, we'll look at the comments. Also, if you guys do want to continue the conversation, you can still comment on this video tomorrow when it's up on YouTube. Well, it'll have the comment section. Adele says, oh, okay. Going into nursing, the one with autism, so he must be at the very functional end of the spectrum if he's going into nursing. And I do apologize to people watching this after the fact who can't read the comments. That's why I read them to you so you know what the people are asking who are participating in the live event. Yes, Kristen, you are welcome. Pamela, you're welcome. And Jenna, yes, you're welcome. So until next time, Dr. Mark Vaughan telling all of you, thank you for being a part of this live event and those who watch it after. And please do comment. Until next time, telling you to stay in good health.